It's more. So we know, for example, from the primary care center, there are 60 patients have been coded in our system so far for long COVID, which again means that they came to us to speak with us, and we realized that maybe there are lots more others. They have mild symptoms and they're not contacted the GP, or maybe others that gone to A&E, and I won't be able at this stage to know, but that's what we're looking at with this study, that hopefully in the next couple of months we'll be able to publish something with all of the data, and of course we're still trying to encourage people to participate with us.
Now, 3 in 5 people in the UK with long COVID are reported as saying it limits their usual activities, with the chance of a full recovery said to be slim. Are you concerned about the long-term effects, particularly on the younger population here in Gibraltar?
The data we have is similar to what is in UK, so there are a good percentage of people, up to 20%, they feel they're not recovered at all from COVID. Another 20% feel they're not recovered completely, and only 54% think they're fine after COVID. So yes, we do have the same concern as UK.
And often the people who are suffering from long COVID, I believe, tend to be people who weren't hospitalised when they had COVID originally.
Some of them were hospitalised, but it's a small amount. It's like 10% of them were hospitalised. So we're talking about patients that might have like mild symptoms even, but they're still struggling now after 3, 6 or 9 months. Very few, hopefully, after 9 months, but there are some.
And some people are dismissing long COVID as anxiety. What would you say to that?
No, I think that it's a real disease in the sense of those symptoms. It's not because they can be, of course, anxiety is one of the symptoms that is very frequent. Depression as well is one of the symptoms very frequent after COVID. But certainly we know that long COVID exists, and it's not all in the mind of patients, which it's a shame that people thought at the beginning. We didn't know. And probably internationally, some of the patients have been probably, treated as anxious at the beginning. We certainly don't do that now.